Hello, welcome to the My Health Journal Train the Trainer Webisode number 2. I'm Ava Crawford, the Women's Health Program Manager with the North Carolina Healthy Start Foundation. The foundation is dedicated to reducing infant deaths and improving the health of women and children across the state. This webisode is designed to train you on how to equip women with the knowledge of what checkups, tests, and screenings they need, and the tools to keep up with that information to make informed decisions about their health. My Health Journal is a self-help interactive booklet designed just for this purpose. It provides space to record checkup appointments, test results, general health history, family health history, and questions to ask your doctor. The journal even has a place where women can set simple personal health goals and a plan of action for living a healthier lifestyle. All this information is conveniently located in one place. You can order the journal for free by going to www.nchealthystart.org. Click on Catalog. The journal is available in English and Spanish. For more information in Spanish, go to www.mamasana.org. As you prepare for training, there are some simple tips to keep in mind. Prepare ahead of time before your sessions. Decide what section of the My Health Journal you want to cover with your audience. Review the information in that section and then prepare your talking points. Your goal is to motivate women to get their personal health business in order. Here are some simple tips to follow. Keep all important contact names, numbers, and resources logged in the journal. If women don't have those contact numbers, encourage them to do their homework. Locate those numbers and write them down. Be sure to keep the names and numbers updated. Now, move them to action. Take the time to do the following. If they need more information or referral, there are numbers listed in the front of the journal that can get them started. Take a look at the list in the back of the My Health Journal of important papers everyone should have. Encourage them to write down any information they need to remember in their health journal. This is also helpful for those close to them to be informed if they were to become ill. Get the women to talk about where they keep their important papers. Are they in one secure place? Are they easily accessible? Encourage them to place their important documents in a Ziploc bag. Provide the women in your group with their personal copy of the My Health Journal. Before they open their journal, ask them when was their last checkup. Challenge them to name the different checkups women need regularly. How many did they know? Have them open their My Health Journal and begin reviewing the Checkup Challenge section together. My Checkup Challenge section lists the different types of exams and tests that are usually recommended. For example, a physical exam, blood pressure check, cholesterol and diabetes test, HIV/AIDS test, STI test, pelvic exam, breast exam, Pap test, mammogram, eye exam, dental exam, or other tests or checkups, possible immunizations. The checkups listed are appropriate for most people, but remind your group that their doctor will be able to tell them their specific needs. Remind the women to take their health journal to their doctor visits. During their visits, encourage them to write down any test results, as well as any answers their doctors might provide to their questions. Keeping good records will help them see any changes in their health status or confirm if they are maintaining a certain health status.
It's very important because a doctor, when they see you, they don't know anything about you, they don't know what you've been through, they don't know your past history. So having all of that stuff in that journal is such a vital key to your doctor actually diagnosing you properly.
The days of seeing the same doctor or healthcare provider are long gone. That's why it's important to encourage women to share their health history and family health history with all of their healthcare providers. We are human, and quite often we forget dates and details. That's why it is very important to have a record of health history on hand. Take time to show your audience how to track and monitor their personal health history. Move them into action. Encourage them to talk to family members about their health histories before their doctor visit. Be sure they write this information down in their journal. This health history should include surgeries, hospital stays, blood type, and immunization records. Have them talk to their doctor about any health history problems or concerns they might have. Have them make a list of the over-the-counter medicines, prescriptions they use, or medications they might be allergic to. Also, any herbs, vitamins, or supplements they might use.
My grandmother had diabetes, and I didn't know that. And she didn't know as well, and we all went to the doctor together, and we had to push her because she was one of the women that, hey, you know, I'm going to take care of my family. I don't care about myself right now. My family's first. So we actually all went together to the doctor with her, and she found out she had diabetes, and we all changed our diets with her.
Reproductive health is another important part of health for women to consider. Start the conversations by getting women to think about their reproductive health plan. Ask the question, what is your plan? What is your plan for a healthy lifestyle? What's your plan for your future? What's your plan for having a baby? How will they accomplish that plan? They know their lifestyle. So what is realistic for them? What works for one may not work for the next person. What is the roadmap for their healthy lifestyle? Don't have one? That's okay. There's no time like the present. Move them to action now. Discuss needs and set goals. Think about their plan for their health, for having a baby or not to have a baby. Monitor and track their health status. Review the reproductive health section of the My Health Journal. Use this as a guide and cover the various methods of birth control. Discuss the importance of knowing their HIV status and getting tested for the virus.
Feel this is a breast model. I want you to touch right here, so I don't want you to feel what a lump would actually feel like. Do you feel that?
Discuss the importance of breast health and the need for a monthly breast self-exam. Early detection is the key to surviving breast cancer. There are diagrams and a guide in the My Health Journal to learn how to do a breast self-exam. There's a place in the journal for women to mark the circles each month when they've done their monthly breast self-exam. Encourage them to keep a menstrual chart to keep track of their periods or any unusual bleeding or painful cramps. Remind your audience that their physical exam may include a talk on birth control, sexually transmitted infections, and risk of sexually transmitted infections. The visit may include a breast and pelvic exam. Be ready. Be sure they are prepared to ask the doctor about any concerns that they might have. Thank you for taking time to view and participate in this webisode. The next webisode will train you on how to guide women to eat smart and move more and maintain good emotional health. We encourage you to join us, the North Carolina Healthy Start Foundation, to begin your efforts to plan and integrate the My Health Journal concepts in your organization. This resource can help you empower women to be confident and better equipped to make informed decisions about their health. Using the journal, women will be able to better plan, prepare, track, and monitor their health status. In turn, you will be able to expand your current programs and services and collaborative partnerships. Remember, healthy women build healthy communities. For more information and to order free materials, visit www.nchealthystart.org or call 919-828-1819.
Information in this webisode is for educational and training purposes only and should not be considered as medical advice. Information in My Health Journal is not intended as medical advice. Medical questions should always be directed to a trained healthcare provider.